Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay, and I'm your host. Today, we're learning what you need to know about stroke. To help us learn more are Peterson Masigan, a registered nurse and clinical program manager for the Stroke Center at Mount Sinai Beth Israel, and Dr. Erick Eiting, Vice Chair of Operations for Emergency Medicine at Mount Sinai Downtown. Gentlemen, welcome to Mount Sinai Live.
Thank you for having us.
Thanks for having us.
Peterson, let's start with you. An important question that we're here to answer. Let's start with the big one. What is a stroke?
Yeah, that's a great question. So a stroke essentially is when the blood supply to an artery in your brain is blocked or it bursts. So what happens then is your brain cells, they die due to the lack of blood supply to it. That's essentially what a stroke is.
Excellent. All right, so we start there. Erick, let's come to you. People might also hear an acronym around stroke, and it's TIA, or transient ischemic attack. What is that? What does the audience need to know about a TIA?
Yeah, great question. So a transient ischemic attack is what we like to think of as our body's warning sign that you're probably about to have a stroke. And so oftentimes you're going to have the same symptoms that you would have when you actually have a stroke. The difference is the definition of a transient ischemic attack means that your symptoms have to resolve completely within 24 hours, but most people are going to have their symptoms resolve within a few minutes to hours. But it is a warning sign, and that means you really should be seeking medical attention if you're experiencing symptoms of stroke.
Okay, good information. And you mentioned warning sign. Peterson, what are the warning signs of a stroke? This feels like this one's important.
Yeah, absolutely. This is something that everyone should know about because this can save someone's life or independence. So things that we want to think about as someone might be having a stroke is if we see a sudden weakness or numbness on one side of the body. It could be your face, it could be your arms, it could be your leg, it could be all three. Any sudden problems with talking or understanding or both. Could also be slurring your speech. That could be a sign of a stroke. Vision changes, any sudden changes, blurry vision, double vision, not seeing in one side of your visual field or a quadrant, that could be it. And another one could be balance problems. If all of a sudden you're finding that you're dragging your feet or you can't keep your balance and it's sudden change, that should alert you to be thinking, could this be a stroke?
Excellent. Great information there. Erick, there's an acronym that goes along with stroke, and it's BFAST, BEFAST. What does that BFAST acronym stand for?
Also a great question. And part of the reason why we like to stress the BFAST algorithm is because time really is brain. This is a time-sensitive condition, so we want to make sure that we're making things happen fast. So BFAST it stands for the following. B is balance. Okay, if your balance is off, that may be a sign of stroke. Okay, the next is eyes. Okay, if you're finding that your eyes, either you're having some kind of vision changes or your eyes are looking asymmetric, that can also be a sign of a stroke. The F is for face. And we call this facial asymmetry. When both sides of your face don't look exactly the same, then one is suddenly off, then that can be a sign of a stroke. The A then stands for arms and legs. And if you suddenly have either weakness and or numbness in one of the arms or legs, that can be a sign that you're having a stroke. The S stands for speech. So if your speech is impaired, and sometimes that means that the words that you're saying sound clear, but they don't make sense. Or if you just can't comprehend other people's speech, that could be the sign of a stroke. And the T is for time. And again, it's really because time is brain. This is a time-sensitive condition. We take this very seriously in emergency medicine, and we try and make things happen as quickly as possible when we're concerned that somebody may have had a stroke.
Peterson, time was mentioned a few times in that answer right there. Why is it so important that we pay attention to this time?
Absolutely. So as Dr. Eiting was saying, and as I said earlier, that when you cut off the blood supply in your brain, your brain cells die. And the thing about the brain cells, the special thing about them is, unlike other cells in our body, we don't regenerate the brain cells that allow us to think and control our body and all that really important function in our lives. So if a person is having a stroke and they can come to the hospital as soon as possible, there are things that we can do to help fix the problem, particularly if the problem is related to an artery that's blocked. So there's a special medicine that we have in hospital, so you can only get it in the hospital, that dissolves that clot. But we can only safely give that medicine within the first 4.5 hours from the time you have that stroke. So that's why Dr. Eiting and I are really stressing that you want to make sure you pay really good attention to time. So you need to know when you had the stroke or your family member, and as well as to get to the hospital right away so we can give you that medicine safely. The other thing we could do is that we can actually go into the brain through the blood vessels in your body and take a very small catheter and pull out that clot. And then we can also help potentially reverse the damage, or not reverse the damage, but decrease the amount of brain cells that die in total. And again, there is a time limit for that. We can only safely do that for a certain group of patients up to 24 hours from the time of stroke. But again, it goes back to not wanting brain cells to die. Time is brain, like Dr. Eiting is saying, and we don't regenerate those brain cells. So that's why we need to be fast when we think about stroke.
Be fast. Time is brain. Dr. Eiting, we're hearing about warning signs. We have that acronym. We understand the reason that time is of the essence, but what should I do tactically if I think someone is actually having a stroke in my presence?
So if you think someone's having a stroke, the key is call for help. And that call depends really where you are. If you're out in the community, that means pick up the phone and call 911, because you want to make sure that you're getting somebody into a setting where they can get the healthcare that they need as quickly as possible. So if it's happening in the community, call 911. But we even reinforce this with our teams in the hospital, that if somebody's having this, we have a special line that we activate when we are getting our stroke team down to the emergency room as quickly as possible, so that we can start to take advantage of those critical moments. And we make sure that we're getting the wheels rolling as quickly as possible so that we can save as much of the brain as possible if somebody's having a stroke.
Peterson, let's talk about risk factors. What are the risk factors for a stroke that the audience should be aware of?
It's a great question. So things that we want to make sure we look at to decrease the risk for strokes, things like high blood pressure, smoking, diabetes, particularly type 2 diabetes, high cholesterol, physical inactivity and obesity, excessive alcohol intake and illicit drug use. If you have an irregular heartbeat or what we call atrial fibrillation, that's another risk factor. And the thing that Dr. Eiting talked about earlier is that a TIA, it's basically like a warning sign in of itself, is also a risk factor. And having had strokes in the past puts you at more risk for strokes.
Dr. Eiting, let's talk about reduction of those risks. We understand the risk factors, but what do you recommend people do to reduce their risk of having a stroke?
Yeah. So if you know that you're somebody who has one of those conditions that Peterson just talked about, and you know that you're higher risk, the first point is make sure that you have that conversation with your doctor. We want to make sure that we are doing everything that we can to optimize your treatment. So if you have diabetes, let's make sure that we're getting that under control. We're giving you the right medications and that we're helping you make the changes to your diet that you need to make. The other piece is hypertension or elevated blood pressure is also a reason why you can develop greater risk for stroke. And so making sure that you're taking the right medications and doing the right interventions to get those diseases under control. That's really the best thing. And I cannot underestimate the value of exercise, making sure that you are getting out there, having that cardiac activity that really helps to make sure that you're doing the regeneration that you need to, that you are on that wellness track that you need to be on. It does so many things from a restorative standpoint. So make sure that you're doing regular exercise, work with your medical professional, take your medications on a regular basis. Those are really the key elements to kind of controlling your risk for stroke.
Dr. Eiting, as a physical therapist, I could not possibly agree more about exercise. Peterson, we come back to you finally to wrap up. There's a great resource that we have at Mount Sinai. What should our audience know about the Stroke Survivor Support Group at Mount Sinai?
Yeah, so the Stroke Survivor Support Group is a support group that is specifically for stroke survivors as well as their families and caregivers. And it allows them to connect with other stroke survivors and share their experiences, particularly with people who recently have had a stroke. We run the Stroke Survivor Group every first and third Thursdays of the month from 3 p.m. to 4:30 p.m. Pre-pandemic, of course, we met in person at Mount Sinai Union Square, but with the current situation, we are currently meeting on Zoom virtually, still the same time and day, and we're hoping that once the pandemic is over or the cases go down, that we're able to return to either fully in person or a hybrid mode where we have people within the Manhattan area or New York City come and also have a Zoom component. Yeah.
That's some fantastic information and great resource. Gentlemen, thanks so much for the insight and helping us learn more about stroke. You can find us at Mount Sinai NYC on all major social platforms. This has been another Mount Sinai Live broadcast. We stream smart healthcare information that's simple to understand so you can improve your health. I'm your host, Jimmy McKay. Thanks for watching.